mynews.studio.
Imagine if millions of cancer cases just didn't happen. Not because of better treatments, but because we prevented them in the first place.
Today is February 23rd, 2026. There's a new study, backed by the UN, that analyzed cancer cases from 2022. Out of all cases worldwide, over a third, 7.1 million, were linked to things people can actually change. This isn't speculation. It comes from data across 185 countries.
The scale is enormous. The researchers looked at 36 types of cancer and 30 different risk factors. What really stands out is that about 37% of new cases are tied to things like smoking, diet, alcohol use, and lack of exercise. Tobacco alone accounts for 15% of all cases.
That's a big proportion. When we talk about modifiable risk factors, what exactly falls under that? It's more than just lifestyle, right? I mean, there are infections too, like HPV and hepatitis B. These play a huge role, especially for women.
Exactly. The numbers show tobacco is behind 23% of men's cancers and 6% of women's. Infections, on the other hand, make up about 11% of women's cases. So it's not only about what individuals do, it's about public health, vaccines, education, the whole system.
It's not just a health issue. There's an equity angle too. The study found big differences between regions. In East Asia, for instance, 57% of men's cancers could have been prevented, but for women in sub-Saharan Africa, it's 38%. Why do these rates vary so much?
A lot of it comes down to policy and local context. In East Asia, tobacco use among men is much higher, so cutting tobacco could have the largest impact. In sub-Saharan Africa, the bigger issue is infections, HPV and hepatitis B, where vaccination coverage is lower.
So, interventions really need to match the local risks. If East Asian governments raise tobacco taxes or enforce stricter bans, it could have an immediate effect. In sub-Saharan Africa, scaling up HPV and hepatitis B vaccinations could make a huge difference for women. Is it really about tailoring strategy to the risk profile?
Yes, that's exactly it. And there's a sense of urgency here. If nothing changes, cancer deaths could go up by 50% by 2040. But look at the flip side. Nearly half of cancer deaths in 2022, 4.5 million people, could have been avoided with better prevention and early detection.
That leads to the practical question. What changes in daily life have the biggest effect? Is quitting smoking still the number one thing people can do?
It is. Stopping tobacco use alone could reduce cancer cases by 15 to 19%. For example, quitting can cut your risk of lung, bladder, and pancreatic cancer in half. But prevention isn't just about smoking. Vaccination against infections like HPV can prevent around 10% of cases, especially cervical cancer.
What about alcohol? The study says that limiting alcohol to 1 drink a day for women and 2 for men can help prevent cancers like breast, liver, and colorectal. But if you also smoke, the risk adds up.
And let's not forget weight and activity. High BMI and physical inactivity are linked to up to 8% of cancer cases. Just 150 minutes of exercise a week, so a walk every day, can reduce risk by up to 8%. Think about the impact if cities created more green spaces or workplaces encouraged regular movement.
It sounds like government action is essential. Are we seeing real policy shifts in response to these findings?
There are some signs. The World Health Organization is calling for stronger tobacco controls and better air quality laws. In the U.S., smoking rates have dropped to a historic low, just 11%, thanks to prevention efforts. We're also seeing pushes for wider HPV vaccination and new alcohol regulations in several countries.
But outcomes will still depend on local capacity, right? Some countries have strong health systems, others don't. How do we make sure prevention actually reaches low-income populations, who often face the highest risks?
That's really at the heart of the challenge. The International Agency for Research on Cancer is urging national cancer plans that focus on equity, especially in countries with lower Human Development Index scores. So it's about funding, public education, and building the basic health infrastructure needed for prevention and early detection.
So, if we sum things up, More than a third of cancer cases worldwide could be prevented. The tools are there. Stop smoking, get vaccinated, limit alcohol, stay active, improve diet. But the biggest progress will come when governments and organizations put prevention front and center. Isn't that the real shift we need?
Prevention isn't only a personal decision, it's something society has to take on together. The evidence is there. Millions of lives could be saved, and health systems would face less strain if action starts now.
That's all for today. We began by asking if prevention could be our strongest weapon against cancer. And this new UN study suggests it can, if we're ready to change both our personal habits and public policies.
Thank you for joining us as we explored just how much cancer can be prevented and what can be done about it.
Thanks for listening. This episode was produced by mynews.studio. You can try it now for free.